See you, Sonny. Thank you, everyone. It is my privilege to call the Health and Human Services Committee to order, and I want to welcome our fellow governors and our distinguished guests. We have a very timely and meaningful agenda for this afternoon, and we're going to focus the majority of it on what we think is going to be the big issue of this year once the fiscal stabilization measures are passed, and that is health care reform. I want to thank Governor Bredesen from Tennessee, who's been a great leader in health care, for being here today. Governor Nixon, who is a new governor, but from Missouri, and obviously greatly concerned about the cost and accessibility of health care in Missouri. Governor Rounds, who is just a great champion on this as well. Governor Perdue and Governor Patrick, I really appreciate you all being here. I think we'll be joined by a couple of others as well. Oh, Governor Hoeven also just joining us. Thank you so much. Appreciate your presence. And I want to say a special thanks to Matt Salo, who has been our NGA staff and the HHS committee. Really appreciate your efforts. You're going to have a lot of work to do this year. All right. So healthcare reform is a very important issue. We've got a couple of very important guests that we have invited that are friends to many of us, and I will introduce them in just a moment. But clearly, this is an issue that governors care deeply about because it's our citizens that we see every day who are impacted. And it's all about access, quality, and affordability. All of the life stories that we hear from people every single day back home document the need for systemic changes. And there are more than 47 million people in America now who are uninsured. Public programs clearly are under tremendous stress to pay for the increased need for health care during this economic crisis, and the coverage that people receive is unnecessarily expensive most of the time, and some of the time of poor quality. Improvement is needed to every aspect of the system. So, with this ongoing world financial crisis, some have asked whether the time is right for an effort at comprehensive health care reform, and I think in the U.S. This is exactly the time when we can get some meaningful reforms through. It's an essential part of restoring America's overall economy and of protecting the financial security of our working families. So we've got to find innovative and new ways to provide affordable, accessible health care for all. We know that health care today places a significant burden on individuals and families and businesses. Just so that everybody's on the same page, health care premiums have increased 117% for families and individuals and 119% for employers over the past 10 years. So we know the cost is going through the roof. It's unsustainable for businesses. It's unsustainable for individuals. And equally concerning, just as the rising health care costs threaten the ability of Americans to have access to care, but certainly the stability of business as well, it also threatens to destabilize the fiscal health of the nation. The U.S. Currently spends about more than 16% of our GDP on health care, which is a much greater share than all of the other industrialized nations. By 2017, statistics say that healthcare expenditures are expected to consume 20% of the GDP, $4.3 trillion annually. That is a heck of a lot of money. So we thank the President for signing an economic recovery package into law that is going to help states' ability to afford the rapidly increasing cost of Medicaid and not have us be forced to cut people off of health care. And a program as well, the American Recovery and Reinvestment Act also invests, as you all know, in healthcare IT, another important part of healthcare reform. But it's clear that much broader reform has to be accomplished. It will be accomplished this year. We were just told by the director of the Office of Management and Budget this is going to be the next priority up for the Obama administration once they get the economic stabilization pieces through. The House, the Senate, the White House have all made this a top priority, and governors are going to do that as well. We have formed a health care reform task force as governors. We have been invited to provide input to the Obama administration and to Congress on what we would like to see as governors moving forward. So we're going to jump on that with both feet and present them with a plan that we believe will be a bipartisan plan that can have support in Congress. So fortunately, we're joined today by two wonderful guests who have been at the front and center of the health care debate, the health care reform debate, and each of them have more titles and honors than we have time to list, and they're no strangers certainly to governors and the issues of states, and I'm honored to call them both friends. I'm going to start with asking Congressman Dingell to say a few words, and then to Secretary Leavitt. Let me just say a word about Congressman Dingell, though. He represents Michigan's home, my state, obviously, the 15th District. He's Chairman Emeritus of the Committee on Energy and Commerce. He's going to have the lead role in crafting national health care reform legislation for the House of Representatives. He's recently become the longest serving member of Congress in our nation's history. And what a treat to be able to have him here today. Every person in Michigan is indebted to him for his great leadership on behalf of our state and what we believe is going to be a capper on this fabulous career of his, which is to be able to usher through health care reform in the way that he has introduced it almost every single year, if not every single year, since he has been a member of Congress. So, Congressman Dingell, will you share your thoughts with us today?
Governor, thank you for that very gracious introduction. I want to say how proud I am to see you and how proud we in Michigan are of the great job you're doing as our governor under very difficult times. And I know all of you governors have huge difficulties to confront. And it's a privilege to be with you, and I thank you. And I want to say how pleased I am to be here with Governor Rell and also my old friend Mike Leavitt. We have shown that it is possible to be good friends even though you are on different sides of the aisle, and to work together on some difficult matters, and have some grand fights too. Well, I'm delighted to be here to talk with you about one of the great problems we have in this country, and that's adequate health care. Governor, you didn't tell us that, but they're anticipating that somewhere around 2070, the two curves, that of health care costs and that of the national income, will cross. So we better do something fairly quick. I begin by thanking you for mentioning my legislation on health care. It was my dad's. He introduced it for Harry Truman in '43. It was interesting to note that at that time it was a matter of humanitarian concern. Today it's a matter of economic concern. And the great coffee supplier that you see when you go down the street spends more on health care than they do on coffee. And General Motors claims to be an automobile producer, but in point of fact, they're really a health care deliverer. They spend about $11 billion on it. And it's interesting to note that there's $1,600 in health care in every car that's driving down the street, and there's only $750 worth of steel in it. I'm sure you governors confront the serious problem, because I know, Governor, your expenditure on health care in Michigan is about 20% of the state's budget. You may want to correct me, because it may have gone up since the last I've heard. So people are suffering, business is suffering. If our American auto industry could put that $1,600 in their pocket, we'd have the most successful auto industry in the history of mankind. But regrettably, we don't. And I'm hoping that General Motors and some of the other people who are affronted by this will come to understand the importance of it. The coalitions appear to be forming. Your leadership is going to be incredibly valuable because we've done some things to help you with your concerns. SCHIP we passed, which I hope will be of value to all of you in terms of covering kids, because it's going to cover an additional 4 million. That'll leave you a few that you won't have taken care of, but it's progress. In addition to that, we not only did we pass SCHIP, but we have moved forward with a great deal of progress in what is rather an extraordinary early part of a congressional session. We have invested $19 billion in health information technology, something which we hope will make your tasks easier. And also a full $1 billion in a new prevention and wellness fund. In addition to that, we have put $1.1 billion into comparative effectiveness research so that you can find out which treatments work best and how you can best use the wonderful technology that we are developing on almost a day-to-day basis, which parenthetically seems to be costing us a hell of a lot more than it's really doing for us. In addition to that, we have put $87 billion over the next 2 years in additional federal matching funds to help maintain your Medicaid programs. We hope that that will be helpful, and we hope that it will do more than we think that it will, because it is going to just about only keep you in the states even with where you have to be. And of course we understand the huge budget deficits that the governors confront. We know that there is a real place for what you are doing in the states. As you know, I am a single payer proponent, but I'm also a smart Polak, and I understand, gentlemen, that we aren't going to get what I would like to get, and that we're going to probably evolve something more like the Canadian system or something like you, Governor Patrick, are doing up there in Massachusetts. And I want to say we're all rooting for you with your difficult problems, but with the tremendous progress which you have made. And we're hopeful that we could get started on putting something together that will maybe slow the tremendous increase that our governor has just mentioned in terms of the cost, but also to see to it that we cover some of the 47 million Americans who lack health care in this country. And that number, by the way, seems to be growing because of the fact that industries and everybody else is under terrible pressure to cut services and the cost of these things at this particular time. So we're going to be looking forward to your guidance and wisdom, because we're going to need to mix and meld a huge collection of different kinds of plans, public, private, industrial, and we're going to have to see that we avoid some of the mistakes which we've made earlier. One of my concerns is that we get started on this at an early time. As my dear friend, our governor, mentioned to you, it is in the budget. And I want to say thank God for that, because the last time President Clinton did it, it was not. And that did hurt us somewhat. But the biggest difficulty that many of you will remember is the fact that the plan was slow coming up. The President made a stem-wider of a speech in February, which was followed by a long period of inaction. And we didn't get the legislation up until the month of November had arrived. And the curse of that was that by that time, the forces opposed to this had spent over $500 million and assured that we lost it by one vote. At that particular time, I handled the legislation, and up to that time, it was the greatest single legislative disappointment which I had ever confronted. So we're hopeful that we have learned from these lessons and that we will do a better job, including getting it up earlier. I have mentioned this to the President both in a letter and in a personal discussion which I've had with him, and he has indicated that he understands the need for these things. And your input in terms of both content and getting this thing started would be of enormous value. So I look forward to your help, your guidance, and your leadership. And just to summarize, we want to constrain costs, as you all know from your personal confrontations with this difficulty. In addition to that, it's got to embrace all of the different plans that we have, public, private, and it's got to give robust coverage to American families so that we can see to it that we become the healthiest nation in the world instead of a nation that drags very, very far down in the statistics with regard to death, life expectancy, and infant mortality. In addition to that, I think it is going to have to preserve and protect Medicaid and the other health care programs. But it's going to need to take advantage of the opportunities for saving that we have in seeing to it that the competition between different kinds of plans and the overlap which we confront will no longer plague us in the future. So I think, Governor, and my other dear friends, the governors, I've stayed within the 15 minutes that was suggested for me, and I look forward to a further colloquy when you think it's right, after you've received the advice of my dear friend, Governor Litt.
Thank you very much, Chairman Dingell. Really appreciate your willingness to come and share some of your thoughts, because you will be guiding us as we move this through.